Hi everyone, Dr.Jyotsna here. Today I will be talking about how to choose an antibiotic. To choose an antibiotic, we have to do risk stratification of a patient. Whenever a patient comes or we see a patient and we think that this patient needs the antibiotic or we need to change antibiotic, what we have to do, we have to do a risk stratification. That is done on basis of three things. First things, whether this patient was exposed previously to the healthcare system or not, whether this patient was exposed to healthcare system but for minimal invasive procedure, or he was just in the home care system, or was or and if the patient was in the hospital, so whether the patient was for more than 5 days in the hospital, and if this is about the whether the patient was in hospital, whether he was just he was exposed to the healthcare system, how many invasive procedures has been done, and how long he was in hospital. On the basis of that, another thing is we have to see whether this patient has received antibiotic previously or not. If no, if yes, how long he has received, how many antibiotics he has received, and if he has received these antibiotics even of this source control, whether the patient is still having fevers, whether the patient is still and whether the patient has become hemodynamically unstable, and whether he has got the risk factor of any invasive fungal infection. In the same way, we have to see whether the patient is young or old, whether he is having a comorbidity, or whether the patient having immunocompromised stage because of the comorbidity or the medicines or the treatment he is receiving. So on these basis, we divide the patient into three types basically: one with community acquired infection, those with the healthcare infection, and those with the nosocomial infection.